Hello, I'm Dr. Michael Hyman with LA Sexual Health. You can find my website, lasexualhealth.com. In this video, I'm going to be discussing the method of working up or evaluating erectile dysfunction. We don't always do these kinds of tests. Sometimes we're just going to go forward with what we would call empirical treatment. That means just basically letting you try treatment, like Viagra, for example. Other times people have tried Viagra or other kinds of therapies and they're not satisfied or it's not working out, and we want to go a little deeper, so to speak, to find out, a little more information about what's really going on. So what we will typically advise is having you come in for something called penile duplex Doppler studies. And what that means is that, if you understand how ultrasound works, just like, women get ultrasound to see their babies, or maybe you're going to have an echocardiogram is basically an ultrasound of your heart. You use a special type of gel, doesn't hurt, it's just a little cold, goes on the skin, and then a little probe that just rests on the gel, and we can actually see inside. It's not painful, it doesn't use radiation, it actually uses sound waves, so it's very, very safe. And there are different kinds of ultrasounds, some of which use what are called Doppler effects that can measure blood flow. And so what is done here is you come into the office, we'll have you come into our examining room. I will then step into the room with you and administer a very, very tiny injection. It sounds totally scary, but honestly, it is the smallest needle that they make. It literally feels like if you just take your little fingernails and pinch the skin at the very base of your penis, that is what it's going to feel like. It's very rare that anybody says anything more than, oh yeah, I felt that. So it's a tiny little pinch at the base of the penis, and I'm going to be injecting a medication that will actually cause you to have an erection, usually pretty quickly, like we're talking within 5 minutes. And then what will happen is, once you've got that erection, I can then take this ultrasound probe with the gel, and I'm going to just rest it against the side of the penis, and I'm going to be able to not only see your blood vessels, particularly your penile arteries, and you've got a pair of them, one on each side, but I can measure the blood flow going through them, and I can also measure if you are having basically what we call venous leak, which means that the blood's coming in, but it's also just going right back out. You really want the blood to actually, there are something called emissary veins in the penis that sort of shut off so that the blood can come in and gets kind of trapped in there, and that is what produces the erection. But if those emissary veins aren't really shutting off, then the blood's going to leak right back out. And we can tell if that's taking place on these penile duplex Doppler studies. So that's basically the long and short of it. Sometimes at the end of the study, I might administer a second, again, a very tiny injection that will actually reverse the first one. And for those of you who are like, well, why the hell would you do that? Because frankly, you really don't want to be like walking around for, more than 30 minutes with an erection like that. Once you get to, that's like the commercials that they talk about, if you've had a prolonged erection, we certainly don't want to cause that for you, and so we'll sometimes give you a medication to reverse that. But that's basically the quick version of doing penile duplex Doppler studies to evaluate for erectile dysfunction. Again, you can look me up on lasexualhealth.com. I also do what are called doxy.me, which is a HIPAA-compliant privacy website for doctors to do video consultations online. You can reach out to me by email. Look forward to hearing from you. Thank you.